to the coronavirus, it may not seem like it, but this year we've made plenty of breakthroughs. We now have ways to treat COVID-19, whereas before we were clueless. We have faster and faster testing. But the thing we've most needed is a vaccine. Ow! So yes, now that we're so close, what shall our expectations be? Let's get virtual. Can I have a band-aid for my boo-boo?
Oh, come on, grow up.
You've probably heard a lot about Pfizer and Biontech's new vaccine, which they say is 90% effective in preventing symptomatic cases of COVID-19. To put that into perspective, that's almost as effective as the kids' measles vaccine. The flu vaccine is around 40 to 60%, and the hope was that the COVID vaccine would be around 50 to 70% effective. So this is clearly great news. More remarkable still if you consider that normal vaccine development usually takes decades. Nice one, scientists! Pfizer and Biontech's new drug is a bit of a prima donna though. You need to get it in 2 shots, 3 weeks apart, and keep it very cold, which sounds small, but that will have big global implications on how far it can be shipped. It works by injecting genetic elements of the virus into the body via messenger RNA, which, massively simplified, acts like a carrier that teaches the body to block the virus if it shows up. And the hope is that by using messenger RNA, scientists can keep creating new vaccines if the virus mutates. Obviously, that's not a real person, that's a gingerbread person, because if gingerbread gets viruses, then we're in real trouble. And if enough people take the vaccine, those who don't will be protected too by herd immunity. So what can we expect when we take it? Not much. Maybe some fatigue, chills, and a little fever. Not bad. So not too many things to worry about. But the real outstanding questions are, does it prevent more severe cases of COVID-19? How does it work with more vulnerable seniors, for instance? AstraZeneca's Oxford vaccine is one that may be able to deal with the elderly better, perhaps. And just because you've been immunized, how strong will it be? How strong will you be? Will it stop you from spreading the virus? And how long will it protect you? If it clears yet more hurdles, the Pfizer-BioNTech vaccine could be released by the end of the year to those most in need. Our incredible doctors and nurses who quite frankly have been through hell and back. And it's never ever said enough, thank you. Thank you so much for taking care of all of us. And with the news of Moderna's new 95% effective vaccine along with the other vaccines in late-stage trials that are soon to arrive, all of our futures are looking a lot better and brighter. One thing's for sure, when it does get officially released, the Pfizer and BioNTech's vaccine will take months to make a mark. 15 to 20 million people could be vaccinated by the end of the year in the USA. A small start, but as far as COVID-19 is concerned, it might not be the beginning of the end, but as Churchill once said, perhaps the end of the beginning.